response has been tremendous. Number one, the doctors that came from America, they have exhibited the highest level of professional discipline. They wake up by 7:30, they're already operating on our people. And you see people with hernia, goiter, appendicitis. It's been tremendous. And the operations have been so fast and almost painless. And the people cannot believe that they've been operating. Some of these people have been carrying this thing for 20, 30 years. And within 30 minutes, they find that they've been relieved of it. And from the public point of view, the response has been tremendous. We've been bombarded with people since Monday. And in fact, by the second day, we started receiving a lot of people, even from Lagos. There are 2 or 3 people that came from Onitsha. Yeah, and I was shocked. You know, so the response has been tremendous. The people appreciate this kind of unprecedented service, public service.
Has it been a success all around, or have there been any cases of fatal cases?
No, God has been kind to us. Every surgical operation has been successful. Everyone, and I say this authoritatively, and a lot of eye problems have been taken care of. As of now, we have almost 800 people with eye problems, and the public will be almost 3,000 people attended to. And these people are doing operations at the rate of almost 75, 80 in a day. It's successful.
How has the government, that is your local government, been able to help, to assist, especially people that are living in the riverine areas that cannot come out? How have you been able to assist them?
What we did is to carry out a massive grassroots campaign. We have to even use the town crier system to go into every creek and every village to be able to ensure that these people will be here. And because they have confidence in Lagos State government, they believe that it was going to be done as soon as it's done. You can see for yourself, everywhere is full. Usually by 6:30 a.m. this place is already flooded. And what we have done is to also mobilize people in transportation and all that to be able to ensure that they can come on. And everybody is full of praises. There's prayers all around this place.
Some people have been complaining that the number of people that are attending to them are not enough in terms of telling them where to go to for their various problems. We can see that there are so many of them roaming around without knowing where to go to and what to do. Well, what are you doing about this?
I don't think that is correct. This is a highly professional field. We can't just get anybody to be attending to them. And you can see all the doctors, all the nurses. We have 70 nurses attending to people. We have all 52 doctors from America attending to them. This is a specialized field. You can't just get anybody on the street to be attending to them. It's patience because we are having an unprecedented crowd here. So we have to be patient. It can't just be done every second like that, but they have to be examined. Some go for laboratory tests, some are referred for surgery, and they are being given free drugs, free original drugs. So it's not a question of people roaming about. Everybody's at work, and we've been at it like this from morning to 8 p.m. every day.
Can you tell us how many local governments are involved in this exercise today?
It's 3 local governments, Baragi Central, Baragi West, and Alonga local government. We are receiving people from all the 3 local governments. And in fact now, I cannot tell you in the 3 because people are coming all the way from George, Janisi, Mazi, First Park. So everybody's taking advantage because the public has been very intense. So everybody's taking opportunity of this government project. And we can't even talk about local governments now. It's almost like a Lagos State affair now. Everybody's there. Wow,
them for information.
Can you tell us how the process has been so far?
Well, the process is going freely and they are not charging for the treatment, and we only pay for the testing of urine and taking of the hospital card.
So where did you get your file from?
We get it from the general hospital here in Panama.
And you did not pay for it?
I paid 300 for it.
Is this supposed to be like that, or is this supposed to be something?
It has been like that right from origin, so I didn't see any partiality there.
So what do you feel about the entire process? Are you happy?
Well, we thank God the process is okay, it's going well. It's a mix of helping the poor masses, so that is what I have to say there. So thank you very much.
What if one is on the Ataro not at the by the own say attend to Arara and I'm a civil servant. Shemotumatora, Shell Land, Ejo, the governor of our Motula or Conope, what if I want 20 pounds? Oh, you know, my dad, I look up to you.
You speak English?
I can't.
You're just managers, so they've not attended to you?
Yes, we have been here since morning, since 6 o'clock from Lagos. They didn't attend to us, and they gave us dates from the Oba Palace at the Palace.
So what is responsible for this? Why haven't they attended to you?
I don't know. They just told us that we should sit down here. And we sit down, we go do blood tests, do everything. They haven't answered us.
Where did you do the blood test?
At Lagos Island Maternity. This is the report.
But have they charged you for anything so far since you got here?
No. They don't even collect my paper to check it.
One was thyroidectomy. Hello. Good afternoon. 39 selections. We are here to avoid here. You need the first one. The first one, okay. Second one here, 50 Lalia. I will be constructed back at by just finish this one.
You can talk to Dr.
It's going to be expensive. Dr. Love, we had discussed with him, it's going to be expensive, so can we take it as
no, but the others, that's your own. The others also.
Okay. Okay.
Oh yeah, anybody with questions?
What do you want to know? You know.
Doctor, again, you are here this time for this training. I was an idea of those that have received this certificate.
In Badagry? I will let Dr. Shulanke answer that question. He's the medical director. The statistics, they want the statistics since the last 2 days.
For the last 2 days. The last 2 days, we have had over 1,000 screen patients. 1,300. And the I-650, 850 I patient screen. Surgeries 107. General surgery 62. And eye surgery 40. General surgery inclusive of obstetrics and gynecology. Mainly fibroids. We had hysterectomies and fibroid, myomectomy, and hernias for small children and adults. And goiter. Goiter is one that has been done by the specialists from America, Dr. Dada's team and Dr. Lowo Kopo's team. And they've worked wonderfully well. You see, but we must thank our governor. He has upgraded this hospital in no small way. Everything is working. This hospital was built in 1951, and everything in this hospital is working. So I thank him very much.
Dr. Lobo, sir, this project is for Nigerian medical practitioners in the Americas.
Association of Nigerian Physicians in the Americas.
In the Americas, yes. But I want to find out, do you have any plan of bringing or letting Nigerian doctors who are locally based to benefit from this practice of your group?
Oh, as a matter of fact, there are some few doctors who are practicing in Nigeria volunteering to join. They are here with us. So the team were approximately 40. Out of those 40, there are about 7 or 8 Nigerian physicians who are resident in Nigeria.
Dr. Lokupo, how were you able to convince those that came with you that are non-Nigerians for this project?
Well, there's no convincing. They are our colleagues, you know, they are ready to help where the help is needed. When they needed help too, we help them. So it's a reciprocity, you know. So we didn't have to convince them, you know. So you just need to let them know in advance you have this need and you want them to help you. They will, you know, fit it into their schedule. Yeah.
Hello, sir. Dr. Lobo.
We are thinking about coming back, and we've discussed with the ministry, the governor, you know. When we get over there, we get some of our, even if this particular set of people are not able to come, we can arrange some other people from our group that will come. So I can't promise you exactly when, but we're working on it. You know. Okay, bear in mind that some of these people that came with us, all of them are not from Lagos State, even though they are from Nigeria. Since they came with me to Lagos State and my group, we have to go to their state with them. You know, so like I said before, it's a reciprocity, you know. So, but we will be coming back to Lagos State, we promise you. I can't tell you exactly when. As long as God gives us life and this good governor is still here.
Some cheapest from say 5,000, 10,000 to maximum of 35,000 in private hospital, 40,000 cost charges. I've seen even relations of mine who have been avoiding going to the hospital, and they have approached me for financial assistance. And one of cases where they have been charged 150,000 in private hospitals to going for hysterectomy, and they have avoided doing that. In fibroid cases, you might find some costs going as far as 200,000 naira. I've met somebody on the premises of General Hospital when I went in to see my driver, who was admitted then, approaching me that the need of mother was about 170,000 naira for surgery. You can see the amount of money being more or less you cannot quantify the value of time of these professionals from America. The amount of money they are paid there per hour is not comparable to what we pay in Nigeria. And if you downsize that to micro level to bring it to the level of Nigeria anyway, you will still find that is a lot of millions of man-hour, professional hour is being given away free of charge. In addition to the medication and other facilities, the professional time chargeable is of immense proportion. Right now, we can't give you that quantifiable figure of it, other than the consumables. The part of the great thing that they did is the fact that when they were coming, they bring along with them as hand luggage some medication, some other needs that we may there's some other requirements and medicines and equipment that we might need. They might need to perform surgery. So that is another quantifiable item. Then, how much value do you put to a life of a children who could die because of hernia? How much? I just saw a little kid of school age there. The parents avoided surgery because they can't afford it. And this, look, it's what's been saying. The health of our people must not be based. The life of the people must not be based upon the amount of naira they have in their pocket or they are their saving books. Their life deserve attention, and that is what Nigeria as a nation must pay attention to. Healthcare facilities for the poor, and not a separate life for the rich and the well-to-do. Mr. and Mrs. Nobody, their children deserve attention, and it is only from this that we can really appreciate what these volunteer doctors who came as our friend are doing to the state and to the country. I really appreciate it.
Your Excellency, you are...
And I said there are so many ways that you can use those expertise. The entire thing, the part of brain drain, yes, they are not on the ground, they are not available. But the positive side of it is the fact that they've gone over and against substantial amounts of experience and exposure, the modern way of doing things, the ability to perform surgery within 10-15 minutes, and they know what the equipment, the expertise is a valuable asset to the country. All you need to do is find a way to turn that around and make it useful to the society at large. This is part of the compassion of that brain drain into brain gain and goodwill and life-saving for our people. So you can move from the negative side to the most positive aspect of it. One thing that is left on the equation is the leg that we say, finally, here we come. We are back home. And to do that, you have to create the environment. You have to have constant electricity that they are used to. You have to invest in the facilities that we are used to. And that is what we are talking about. The rich must see this. They can stop from now to daybreak about brain drain. Those who are brain stained, are they doing what they have to do? Those are making the milk of economy. Those corporations, I hope they are watching this. When they are avoiding taxes.
Having lived in the state, he knows what he needs to do, and is willing to operate.
We have a set for it. We are holding it.
Actually, he was the last president of AMPA.
Don't need to take all their pictures with you.
Let's see, call. What's their name?
Good. Continue after. You already employed them anyway.
I hear what I heard, and I'm happy about that. I mean, there are valuable lines that you can say, and then you can, it is quantitative analysis and have a life on the because the first priority is the life of over 50 million, 5,000.
Yeah, you want to Chicago business school graduate tomorrow here to the province line.
Yeah. And I think the other
Dr. Sholande, this is your turn.
We have a patient here with acute chronic appendicitis.
Yeah, I'll call you back, okay? Hello? Where are you? Yeah? Yeah. You may stop traffic. Are you coming back? Are you way back?
I thought
Plastic none. In Lagos State today, and in spite of the enormous efforts channeled into making the state conform with its status as the center of excellence, there are still challenges to be met in some critical areas. In fact, as human beings are dynamic in nature, so also are these challenges, a reason which accounts for this persistence. As a result, challenges or problems such as traffic congestion, threat to lives and properties, population explosion and provision of enough accommodation, poverty alleviation are among those challenges that have taxed the efforts and commitment of the present administration. Often, as solutions are described, so do they take another dimension. The management of the state environment also falls within this category. Over time, the problems of incessant flooding, waste management, and general enforcement of sanitation laws have become extremely dynamic, such that it takes dynamic policies to effectively manage.
even with the existence of such organizations as the Drain Drugs, Highway Managers, Lagos State Waste Management Authority, the Kai Brigade, the general environment in the state, with considerable success, also take two. There's something wrong with that thing. Ever, I'm stopping. There's something wrong. Even with the existence of... Okay. Even with the existence of such organizations as the Drain Docs, Highway Managers, Lagos State Waste Management Authority, the Kai Brigade, the general environment in the state, even though has already recorded success, still need a lot of efforts to achieve the desired results. Tonight, State and Focus takes on the Honorable Commissioner for Environment, Mr. Tunji Bello, who speaks on the numerous efforts being channeled by the state government into making the state general environment reflect what it should be, decent and homely. Goodbye.